Marc suffered from advanced gum disease. Every tooth in his mouth was loose. He could not eat normally. Dentists in France told him he would need bone grafting and zygomatic implants, and it would cost €40,000 with no guarantee of success. Then he discovered basal dental implants, and in just 5 days, Dr Genchev in Plovdiv, Bulgaria, gave back to Marc the smile he had before the gum disease started, at 1/4 of the French price. So how did Dr Genchev do it? Marc suffered from advanced periodontitis. The inflammation caused all the teeth to be loose. The cancellous bone was porous, and Marc had granulomas, pockets of infection at the roots of multiple teeth. In the lower jaw, the bone was better quality. There were 2 conventional implants previously placed in positions that were at risk of micro-movements. Dr Genchev completed Marc's full mouth restoration with immediate loading basal dental implants. They anchor into dense cortical bone, which is deeper. There is no need for bone grafting, sinus lift, and no zygomatic implants. On the upper jaw, Dr Genchev placed 17 basal implants, 8 on the right side and 9 on the left. He added more implants because the bone was porous. Dr Genchev placed 2 tuberopterygoid implants, 1 on each side behind the sinuses, to recreate full mastication functionality and provide more stability. The bone of the lower jaw was stronger. He placed 8 basal implants, and the 2 conventional implants were used to support the new bridge. Both bridges were constructed in PFM metal ceramic, combining durability with natural aesthetics. Each bridge carries 14 crowns to restore the full chewing functionality. Marc chose the shade A2. It is a natural off-white. It closely replicates real tooth enamel. The crowns were made to measure to reproduce Marc's original teeth. Dr Genchev fulfilled Marc's dream of recovering his smile when he was a younger man. In 5 days, Marc left Plovdiv with a complete set of teeth. He could eat normally and smile with confidence, and he saved nearly €30,000.